Hello, this is Nurse Patty Anderson. I am a board certified family nurse practitioner, and I'd like to discuss erectile dysfunction with you today. So, again, I am Nurse Patty Anderson. I reside in California, and in addition to my personal activities, I like to make myself available to patients who have no primary doctor and need medications, need labs, or just need a consultation. What do nurse practitioners do? We help with preventive, episodic, and chronic disease management by maintaining the health of patients across the lifespan. So that means infants all the way to very elderly patients are the nurse practitioner patients. We provide patient education and counseling to help patients make lifestyle choices and promote overall health. We order, monitor, and interpret labs, and we order imaging studies and review them so patients can make informed decisions. So let's get into erectile dysfunction. Some of the terms for erectile dysfunction include impotence or ED, or even terms like having trouble getting an erection. Well, that's exactly what erectile dysfunction is. It's a range from inability to getting an erection or difficulty maintaining an erection. But regardless, this can be a very embarrassing and highly stressful condition that leads to relationship issues. Erectile dysfunction can also be a signal that there is something more concerning going on inside the body. Sometimes erectile dysfunction can be caused by stress and anxiety, but it can be the result of blood vessel disease like heart disease or diabetes. So just be aware that erectile dysfunction can be a very early signal of other. When having erectile dysfunction, men may experience reduced sex drive. They may also have soft erections. They may have anxiety, and they should be evaluated for underlying physical and psychological conditions. If treatment of underlying conditions doesn't help, then medications or assistive devices such as pumps can be prescribed. How do erectile dysfunction medications work? Well, the commonly prescribed erectile dysfunction medications are a part of a class of medications called phosphodiesterase type 5, PDE5 inhibitors. So PDE5 inhibitors block the action of an enzyme called PDE5, resulting in an increase in the level of cGMP, which causes relaxation of smooth muscles in the vessels of the penis. This causes an increase in blood flow, helping produce an erection. PDE5 inhibitors also have other clinical uses, and PDE5 inhibitors medications are enhanced by nitric oxide. There are many common brands of erectile dysfunction medications. These common names include Viagra, Cialis, LEVITRA, Stendra, Caverject, Muse, and Relatio. Well, what is Viagra exactly? Viagra is a medication that contains the active ingredient sildenafil, and it's used to treat erectile dysfunction. Viagra is similar to Cialis and LEVITRA, and it does belong to the class of medications called phosphodiesterase type 5 inhibitors. Through its mechanism of action, Viagra does help relax smooth muscle in the penis and results in increased blood flow, thereby increasing the life. Viagra does not work if there is no sexual stimulation. So, in other words, if a man is not sexually excited at the time Viagra is used, a man cannot. Cialis, and how does it work? Well, Cialis also belongs to the class of PDE5 inhibitors and works similar to Viagra and LEVITRA. It also helps relax the arteries in the penis and the muscles and results in a process that leads to stimulation of chemicals called cGMP in those smooth muscles, leading to increased. After the administration of an oral dose of Cialis, the plasma concentration reaches a maximum concentration within 6 hours, and most of the drug is bound to proteins. The active ingredients in Cialis have a terminal half-life of approximately 17.5 hours, and its metabolites are excreted in the feces and in the urine. Cialis should be taken without regard to food, and it should be stored in the refrigerator. How LEVITRA works? Well, LEVITRA has the active ingredient vardenafil, and erections compared to Cialis are shorter in durations, and the LEVITRA drug does also belong to the class of cGMP, the cyclic guanosine monophosphate specific phosphodiesterase type 5 inhibitor, and it's again similar to Viagra and Stendra. While safe in many people, medications like erectile drugs have side effects like many other drugs do. So people who are taking medications called nitrites, including isosorbide dinitrate, isosorbide mononitrate, should not take erectile dysfunction medications as they can cause dangerous drops in a man's blood pressure. And so you should consult your provider or pharmacist for any recommendations before taking erectile dysfunction medication. Now, what about women with low sex drive? Women or men who are looking for help with low sex drive might want to consider having their labs checked to assess their hormone levels. However, women may also consider a prescription for ADI or Vyleesi. ADI and Vyleesi are medications that are indicated for some women with hypoactive sexual disorder. Vyleesi contains the active ingredient called bremelanotide, belonging to a class of medications known as melanocortin receptor agonists. Flibanserin has a mechanism of action which is not well understood yet, but it does have on a woman's sexual desire. So other management options other than Cialis, LEVITRA, Viagra, Stendra, Caverject, other management options include testosterone supplementation, and that is indicated for men that have a morning total testosterone of less than 300 nanograms per deciliter. Trazodone or Deserel, 50 to 100 milligrams by mouth every night. Korean red ginseng, 900 milligrams 3 times daily. And vitamin E are other recommended management options. Due to lack of safety and standardization, Yohimbe is not recommended for dysfunction. Getting an erectile dysfunction medication online is not as simple as just purchasing one. Instead, erectile dysfunction medications need to be written by a medical provider and dispensed by a licensed pharmacy. By using pushhealth.com, you can be connected to a medical provider for consultation and a prescription if it is safe to do so. What kind of labs would you need to consider if you have erectile dysfunction? Well, complete urinalysis, complete blood count, fasting lipid profile, testosterone level, free testosterone, follicle stimulating hormone, luteinizing hormone, specific, prostate specific antigen level, even thyroid stimulating hormone or gonorrhea, chlamydia, syphilis, and HIV tests are some labs to consider evaluating when you're having a problem with it. So again, you can visit pushhealth.com and enter Patricia Anderson in the search engine to have a secure, seamless visit with your provider and obtain medications for erectile dysfunction. I do hope this presentation has been useful, and I look forward to your questions, your feedback, and I hope you stay safe and healthy. Bye-bye for now.